Yes.
Hello.
Hello.
Welcome to
Dark
and
Creepy
Things
with
Frank
and
Scout.
Scout.
I'm Scout.
I'm Frank. Hello.
Hello, Rad's Games. Hello, other viewers that we have out there.
I think there's a few of you.
Awesome. Say hello in the chat.
Say hello.
Lloyd from uni. Ah, cool. Lloyd, yes. Awesome. Hello.
Hello.
Have you been... Did you manage to catch up on some episodes during the uni break? And we probably should...
Before we get started, I will do an acknowledgement of country. So Scout and I would like to show our respect and acknowledge the traditional custodians of the land, which here are the Wurundjeri people of the Kulin Nation, on which this podcast is taking place, and I would like to extend that respect to any elders past, present and emerging, and any Indigenous people here today. Awesome.
Thank you. Cool. What else do we usually do? Oh, good. So Lloyd has been listening to the first few while they work on art. That's awesome. Good stuff. First few, wow.
Yeah, those were short.
They were, but that was Stone Baby. Lloyd, have you listened to Stone Babies?
Stone Babies is my favourite.
I'm still scared.
You still think you have a Stone Baby?
Sometimes it's completely impossible, but we're like, yeah, Stone Babies was funny. I'm glad you thought it was funny because...
Back then, like, the episodes are like 20 minutes long. And
no.
Sometimes... Yeah, they were. Some of them were.
One about the Gibbons twins,
yeah. Some of them were like 20 minutes or 40 minutes long, and nowadays they're like an hour and 10, an hour and 15.
Yeah, let's try keep today's to an hour.
Yeah, we'll try. We'll try.
What are some of your favourite ones?
Stone Babies.
Stone Babies.
I actually really like the one about prison food and people's last meals.
Last meal was good.
That's one of my favourites.
I like Johnny Gosh.
Oh, I think Johnny Gosh was weird.
You were scared.
Was that the one where he came to his mum's house and then
as an adult, yeah,
and then he just fucked off, and then
pretty much,
and she just let him go.
Yeah, like allegedly he came to her door with some weird man, and she's like, "Oh, you're my missing son," and then
he just left.
He said, "Okay, bye."
It's just so bizarre. It's like, why would you just let your son just run away?
Yeah,
so bizarre.
Yeah.
What else are some of my favorites? Junko Furuta was intense.
It is, but you know what? I think it's one of our most downloaded episodes.
It is.
Still. I was having a quick look at our stats before.
Who was the other? Which one was that one? Kelly Lane. No, Kelly Lane is our most watched and most listened to episode.
It is, and I still think it's Kelly Lane herself. But
we had this what's it called? Troll kind of go like reviewing us, saying they don't know what they're talking about, and it's like, did you read the premise of this? Like the whole point is that we don't know what we're talking about.
We don't. We really don't.
Yeah.
We don't rehearse. We don't even. I haven't read the article that Frank's chosen for this episode.
I've only skimmed it. I haven't read.
I've been told the topic, which is cool. And we don't even usually do that much. Not even usually the topic. So we don't. This is not rehearsed. We don't know no research. Exactly, and that's how it started, Lloyd. That's how it started with us. Lloyd says, I think it's fun hearing the natural banter between you two while you surprise each other.
Yeah.
And that's how it started, long car trips together.
Oh, yeah.
Hey, I just read this, and hey, I just read that. And we're like, what? And then we should record these. It'd be really fun.
Yeah, because it was, on the way to derby events in the country, like 3 or 4 hour car trips, we'd find each other random Wikipedia articles and read them to each other. And sometimes it'd be like, what is this? And be really interesting conversations.
This loop of down the wiki hole type of thing.
So for those of you who have forgotten or don't know what the premise of this is one of us will read a Wikipedia article to each other. We don't know what it is, other than it is probably something dark and or creepy.
It's meant to be.
It's meant to be. And we've had various different episodes in the past. Scout likes murders.
I like, if you've looked through our list of episodes, the ones with people's names are usually me.
Yeah.
Like, I tend to gravitate towards people, and I like trying to understand the psychology behind their behaviour. Whereas Frank will tend to go for...
I go for more medical things or concepts or events in history.
Exactly.
I mean, yeah, I am interested in people and I am interested in the way that people interact with each other, but not individuals. Individuals kind of bore me.
No way, no way.
I like looking at people who, like groups of people and the way that they react.
Yeah.
So yeah.
So just looking at like the top most downloaded episodes, and like at the moment episode 28, Kelly Lane, person. That was one of my choices. Interesting enough, episode 14 was Murder of Junko Furuta. Name, but that was yours.
But at the same time, the Murder of Junko Furuta wasn't one person. It was a group of people. It was a group of young boys who did that.
Yeah. That's same as, I guess, with Sylvia Likens, which is interesting. It's, again, a person, and I chose that one. But part 2, I
don't know why that one. I don't know why that one's got a lot more views than part 1. Very a lot more downloads. Sorry,
it does.
It's a lot more. It's like 10 more. It's weird.
Then you got another one I did, Amelia Dyer and baby farming. Gibbons twins was you though. So it's
was
people.
it?
Oh no, maybe
that was
me.
You. I was very beginning.
List of unusual deaths.
That was me.
That was
me.
Yeah, Creepypasta was you. Yeah. Incidents at Disney World was you.
That was me as well.
Unit 731 experimentation and warfare.
Well.
That was you. So it's generally, if it's a person, it's probably going to be me. Odds are. And if it's, like I said, something to do with history, some kind of actual topic and stuff, it's probably Frank that's chosen it. It does. Thanks, Lloyd. It does make the content varied and interesting, and definitely a collaboration of our personal interests, where you've got Frank with the sciencey stuff and me with the murdery, crime, people-y thing. Good. I'm glad you had fun.
And I do try to bring some science into it, but I'm probably just blowing smoke out of my ass a lot of the time, to be completely honest with you. But, I mean, scientific reasoning and all.
Yeah.
Who are our patrons, Scout?
Yes, before we go into your topic, boring people with our banter probably, let's thank our patrons, Bitten by the Bug, Japanese Textiles, going off on the Instagram too.
I know.
So many followers that even started making... That's your mum.
That would be my mother. So go follow my mum.
Bitten by the Bug, and started a YouTube channel too.
Yes, don't follow her in a creepy way. Follow her on a social media way.
follow her down the Bitten by the Bug down the street. We also have Library Phone, author of The Mad Scientist of Australian Hot Rodding, Rod Hadfield. Thank you, Library Phone. The Bright Side Comic, and we have our loyal creeper, Sharon. Thank you, our creepers. Amazing stuff. Yes, so thank you. You keep the cats fed and they're sleepy, so hopefully they won't disturb us too much. But
there's been times where we've had to edit out like a good 20 minutes so the cats have been fucking assholes. You just hear jingles in the background.
People, I've been told people listen for those jingles.
They listen for the jingles.
Yeah, jingles are okay. It's just when they're actually like growling at each other,
or bumping,
stomping on us, tipping things over. Yeah.
Peeing on things, which has happened. One episode
got... One of our old apartments, that's right.
One episode had to get, had to be, like, stopped halfway through because we realised we could smell pee on the couch. When she'd peed on the couch. Yeah. We're having trouble with that for a couple of weeks. So that was an interesting time.
You fixed that behaviour.
Yes, she stopped that.
Yeah. All right, so...
Let's do this.
Enough banter.
Now for more banter. So, today is a sciencey one because I'm reading it out. So,
and this is so interesting because you get to actually see my facial reactions or my eyes glaze over going, this is so much science. I don't even know what's going on.
Okay, so we are looking at lobotomies.
I like that.
You like that. I don't think you want one, but you like them. Hang on a sec.
Not today. Is your mic on?
My mic has decided I want to go run down my shirt. Also known as a leucotomy if you're from England. So leucotomy, leucotomies and lobotomies are the same thing. It depends on where you're from. So, lobotomy or leucotomy is a form of psychosurgery, a neurosurgical treatment of a mental disorder that involves severing connections in the brain's prefrontal cortex. Most of the connections to and from the prefrontal cortex, the anterior part of the frontal lobes of the brain, are severed. It was used for mental disorders and occasionally other conditions as a mainstream procedure in some Western countries for more than 2 decades, despite general recognition of frequent and serious side effects. While some people experienced symptomatic improvement with the operation, the improvements were achieved at the cost of creating other impairments. Yeah. It'll go into it, but we're like,
Does it talk? Yeah. You haven't really read through the article.
I'm sure it'll go through exactly.
The procedure of
what they do and
orbital.
Nasal. The procedure was controversial from its initial use, in part due to the balance between benefit and risk. Today, lobotomy has become a disparaged procedure, a byword for medical barbarism, and an exemplary instance of the medical trampling of patients' rights. Ooh, some harsh words there. Barbarism, as in barbaric.
Yeah, definitely. Not that it's real, but not that I watched it real. But I'm recently watching Ratched, the series on Netflix, and that had pretty realistic, I imagine, realistic looking scene of lobotomy.
Which is why I won't watch it.
No. You could just look away for that part.
But you can hear the crunch. No, thank you.
You can mute it and you can look away.
No, thank you.
And I'll tell you when that's over.
All right.
But they showed the old version from doing is it the nose or drilling into the head.
That's not a lobotomy. That's to relieve pressure, and they still do that.
Oh yeah, but this was to alter things. Yeah. Oh, maybe it was in the year. I can't remember. What I saw. But then and then they're like, oh, the surgeon was like, no, I did this wrong. Let's try it through the eye.
What? I did this wrong, so let's go stab your brain another way.
Up to a different patient.
Oh, right. I was going to say, don't mangle up the same patient
no.
than you already have.
No. But it's hugely wrong and against human rights, obviously. They had all these people in, psychiatric places, patients that had no say in what was going to happen to them. They're completely, pretty much sedated all the time. It's let's go take you and see, experiment on you, pretty much.
Well, it's interesting you say that because it's actually not really kind of that way. So they didn't experiment on them so much as it was generally seen as actually a legitimate medical treatment. That's the problem.
But it was still kind of experimental though.
Yeah, well, they didn't know exactly how it worked, other than it worked. But that's the thing. There are a lot of drugs out there. We don't know exactly how they work, but they work.
Taking a drug is a bit different to having your head drilled.
But they are medical treatments.
Yeah.
You still don't know exactly. There are lots of drugs out there. We don't know exactly how they work.
It's still not drilling holes into your head.
No, you're not drilling holes into your head. That's true. But again, there's probably a lot of neurosurgical procedures we don't actually know exactly. We don't know how the brain works. That's the problem.
Yeah.
We don't know. We can't. There's not you can't stab one bit of the brain and know exactly what part of the body that's going to target. We have a general idea, but.
But do you think that's it's probably how they found out more, was by doing.
Oh yes, for sure.
Like this?
For sure. Doesn't mean it was okay.
No, of course not.
You got to remember that humans experiment on each other, and the only way we've ever gotten through science in general and advancements in technology is by harming other things, unfortunately. And it's not just humans. We use animals for experimentation all the time.
Yeah.
Constantly.
Well, we are animals.
Yeah, but non-human animals.
Yeah, ones that don't consent.
No, they don't. But then it comes down to that weighing up of reducing harm as much as possible. Utilitarianism.
Yes.
All right, let's continue. So, I think my microphone is still here.
You're right.
So, on the Wikipedia, I can actually show you. There's a photo of the two scientists.
Well, you could have prepared me for this and I could bring it up on the screen.
But that's all right. There's a photo of two scientists.
The link, as usual, will go with the... you'll get the audio recording, as usual, of the podcast with the link to the article.
Yeah.
I could just I'll grab the link. Keep going. I'll find the link and put it in the chat.
On the Wikipedia article, there's an image of two doctors, and they're looking at an X-ray of someone's head. And it says Dr. Walter Freeman left, and Dr. James W. Watts study an X-ray before a psychosurgical operation. Psychosurgery is cutting into the brain to form new patterns and rid a patient of delusions, obsessions, nervous tensions, and the like.
Is this the article?
Yeah. Cool. Which was from an article called Turning the Mind Inside Out on the Saturday Evening Post in 24th of May 1941. So...
I'll just put the link in the chat, so if people want to check out the article and the picture.
It's important to recognise, though, that this is 1941. 1941, World War II was still going, and the Nuremberg Agreement hadn't been hadn't been established yet. So we've spoken about the Nuremberg Agreement before.
So that sounds familiar.
Basically, that what happened was when the Nazis were found to be experimenting on people in concentration camps, what came out of that and the Nuremberg war trials was the Nuremberg Treaty or Agreement or something, which stated rules around experimenting on humans. So this is pre that, right? So it's pre-patient rights, really, because the Nuremberg trials and the Nuremberg Agreement gave patients rights. So this is before patients had any rights at all. So that's something to remember, that, yeah, this was barbaric. But back then, you could do whatever the fuck you wanted.
Yeah, pretty much.
Because there was no laws. There wasn't any precedent for
That's
this.
what I mean by showing, you know, of course, going back to Ratched, it's fiction. But, you know, still, I don't think it would have been that far off with the doctor, with the surgeon, and then the nurses being like, patient, blah, 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 come with us, and literally going to the surgical room. And then it had, like, yeah, like a little, like, seating, like, tiny stadium seating, like theatre seating, where people sitting in the stands, like, watching.
Yeah, they do that in the surgeries still.
Yeah, they do, but there was no barrier or anything. They were, like, literally there, and you had people, like, chucking up at the sounds and all that kind of stuff. Yeah. I'm sure that...
Were they doctors who were watching this? Like in the show?
Some.
Were they all lay people?
Some were nurses, some were,
lay people. What? Why would you let them in there? That doesn't
be like a performance. Well, because the surgeon's given us to say, yeah, like, come and see this marvellous.
The thing is with lobotomies is that
performing
is that it was quick. You didn't require open surgery. I mean, I'll go into this, and results are almost instantaneous. That's why it was a miracle surgery, because it happened straight away. It fixed the problem straight away. Anyway, so the originator of the procedure was a Portuguese neurologist named Antonio Igar Muniz. I think I'm probably pronounced that terribly wrong. Shared the Nobel Prize for Physiology or Medicine in 1949 for the discovery of the therapeutic value of lobotomy in certain psychosis. However, although awarding of the prize has been subject to controversy. So that's one of the things about the Nobel Prize. Everyone goes, Nobel Prize is amazing. And it's like, do you realize back in the 40s they gave it to the person who invented the lobotomy?
So amazing.
Yeah, humans are fallible. Let's say that. The use of the procedure increased dramatically from the early 40s into the 50s. And by 1951, almost 20,000 lobotomies had been performed in the United States and proportionally more in the United Kingdom. The majority of lobotomies were performed on women. A 1951 study of American hospitals found nearly 60% of lobotomy patients were women. Limited data shows that 74% of lobotomies in Ontario from 1948 to 1952 were performed on women. From the 1950s onwards, lobotomy began to be abandoned, first in the Soviet Union and then Europe. And it comes from two Greek words, lobos, meaning lobe, and tome, meaning cut or slice. There you go. All right. So then there is a comment added to the consent form. So, okay, let me read this quote out. I fully realize that this operation will have little effect on her mental condition, but I'm willing to have it done in the hope that she'll be more comfortable and easier to care for. Comments added to the consent form for a lobotomy operation on Helene Strauss, the pseudonym used for a patient at an elite private hospital. So they knew that it would actually do nothing to help her, but it would make it easier on everyone else.
Yeah.
And that's part of the problem.
Well, that was it too, though. From what I've seen and read about that, was quite often husbands signing their hysteric wives over.
Yeah.
Hysterical wives
or parents handing over what's it called? I don't want to say autistic children because I have no basis of that, but children that were difficult or had mental disturbances or something like that.
Basically anyone who wasn't like the norm and expected was handed over to these places.
Yeah, pretty much.
Doctors and being like, no, I don't want them.
This is the same era as when women were diagnosed with hysteria.
Exactly.
As well.
Exactly.
You're a bit neurotic, you have hysteria. Anyway, historically, patients of lobotomy were immediately following surgery, often stuporious, confused, and incontinent. So stuporious as in a stupor. So stupid. Some developed enormous appetite and gained considerable weight.
Wow.
Seizures were another common complication. Emphasis was put on the training of patients in the weeks and months following surgery. That makes no sense though, because the whole point of this is to try and make them more placid, but then you have to spend weeks and months training them how to eat and go to the toilet again?
Like rehab, because you've kind of messed with their function to be able to do stuff.
Yeah, but that doesn't make any sense though.
Oh, but you fix their personality.
Yeah, but you just created more problems, haven't you?
Well, yeah, but apparently not having a difficult personality is,
less is better than being incontinent. But okay.
And not being able to feed yourself.
Yeah.
Sure.
The purposes of the operation was to reduce the symptoms of mental disorders, and it was recognised that this was accomplished at the expense of a person's personality and intellect.
Mm-hmm.
British psychiatrist Maurice Partridge, who conducted a follow-up study of 300 patients, said that the treatment achieved its effects by reducing the complexity of psychic life. Following the operation, spontaneity, responsiveness, self-awareness and self-control were reduced. The activity was replaced by inertia, and people were left emotionally blunted and restricted in their intellectual range.
You think?
The consequences of the operation have been described as mixed. Some patients died...
Oh, yeah. Mixed.
It's in inverted commas on the article too.
Mixed. I'm following along.
Some patients died as a result of the operation, and others later committed suicide. Some were left severely brain damaged. Others were able to leave the hospital or became more manageable within the hospital. A few people managed to return to responsible work, while at the other extreme, people were left with severe and disabling impairments. Most people fell into an intermediate group, left with some improvement of their symptoms, but also with emotional and intellectual deficits to which they made a better or worse adjustment. On average, there was a mortality rate of approximately 5% during the 1940s. That's a huge amount. 5%? That's...
Mortality rate?
That's a lot. Out of 100 people who have it, 5 will die.
Yeah.
That's all huge. Like if you told people that there's a 5% chance you're going to die in this surgery, a lot of people probably wouldn't take it. I don't think.
5% also sounds low.
It does, but when you look at the numbers, it's actually not.
Yeah.
So if 5 out of 100, it's also 5 out of 100 is also 50 out of 1,000. It's a lot of people. The lobotomy procedure could have severe negative effects on a patient's personality and ability to function independently. Lobotomy patients often show a marked reduction in initiative and inhibition. They may also exhibit difficulty putting themselves in the position of others because of decreased cognition and detachment from society. Walter Freeman coined the term surgically induced childhood and used it constantly to refer to the results of lobotomy. The operation left people with an infantile personality. A period of maturation would then, according to Freeman, lead to recovery. In an unpublished memoir, he described how the personality of the patient was changed in some way in the hope of rendering him more amenable to the social pressures under which he was supposed to exist. He described one 29-year-old woman as being, following lobotomy, a smiling, lazy and satisfactory patient with the personality of an oyster.
Personality of an oyster.
Who could not remember Freeman's name and endlessly poured coffee from an empty pot. When her parents had difficulty dealing with her behaviour, Freeman advised a system of rewards, ice cream, and punishment, smacks.
Oh.
Like literally children. Literally children. Ah, dear. So, lobotomies had a huge impact on patients, and and at the time they didn't have a lot of rights, so it really made it difficult. I'm like infantile personality, like whoa, and smiling, lazy, and the personality of an oyster.
I like that. I'm gonna use that.
A personality of an oyster.
Yeah, I like how that's in quotes. Too.
Yes,
he described one 29-year-old woman as being, following lobotomy, a quote, smiling, lazy, and satisfactory patient with the personality of an oyster. End quote.
Personality
I like
of an oyster.
I'm going to tell people.
You have the personality of an oyster.
Yeah.
All right. So the next section, which is about the history. In the earlier 20th century, a number of patients residing in mental hospitals increased significantly. While little of the way of effective medical treatment was available, lobotomy was one of a series of radical and invasive in physical therapies developed in Europe at the time that signaled a break in the psychiatric culture of therapeutic nihilism that had prevailed since the late 19th century. You're on the computer. Hover over nihilism. The
therapeutic nihilism is a contention that it is impossible to cure people or societies of their ills through treatment. Wow.
So in other words, leave everyone to die.
They don't really believe in that you can cure.
So in other words, they were moving away from the whole we can't cure anyone to the we can try and cure everyone.
Okay.
Kinda.
Right.
Yeah. So I suppose what they're saying is before the 20th century, earlier the 20th century, people just sort of ignored what was going on.
Well, can't fix that person.
Yeah.
Yeah. Okay.
Yeah, whereas then now we're moving into the we can do something now.
Therapeutic nihilism.
Yeah.
I like that.
The new heroic physical therapies devised during this experimental era include malarial therapy for general paresis of the insane, deep sleep therapy, insulin shock therapy,
wow,
cardiazol shock therapy, and electroconvulsive therapy.
We need to cover some of those terms.
Okay, so what is malarial therapy?
First, I'll go back to what they deem heroic treatment. Is in medicine, heroic treatment or course of therapy is one which possesses a high risk of causing further damage to a patient's health. It's very risky.
But it says it's taken as a last resort.
Yeah.
With the understanding of that any lesser treatment will surely result in failure. Interesting.
It is. Malarial therapy, the history of...
so that's just malaria in general.
Okay, right.
So if you want to look about malarial therapy, go on to history of malaria.
General paresis of the insane, also known as general paralysis of the insane, GPI, or paralytic dementia, is a...
It's when you get dementia from having syphilis. So if you have syphilis and it's not treated, it can cause you to go psychotic.
Donald Trump.
It can give you dementia. It makes you go crazy.
Deep sleep therapy, or DST, also called prolonged sleep treatment or continuous narcosis, is a psychiatric treatment in which drugs are used to keep patients unconscious for a period of days or weeks.
Why?
It's just sedating them. They kind of still do that now.
But they don't keep you asleep.
No, you wake up to eat and poo and...
Yeah, but they don't keep
go back to sleep again.
How do they keep them alive? That's another one for another time.
Yeah.
Go on.
Insulin shock therapy or insulin coma therapy, ICT, was a form of psychiatric treatment in which patients were repeatedly injected with large doses of insulin in order to produce daily comas over several weeks.
That's so dangerous.
Yeah.
That's dangerous.
That's really dangerous. It was introduced in 1927 by Austrian-American psychiatrist Manfred Sekel.
Because that kills people really quick.
Yeah.
If you don't control that.
Yeah, wow. And that cardiazol, is that how you say it? Cardiazol? Cardiazol shock therapy is...
So cardiazol is a drug?
Yeah. It's a drug formerly used as a circulatory and respiratory stimulant. High doses cause convulsion.
Interesting.
Right.
And then electroconvulsive therapy, that still happens.
Still is.
It's a lot more regulated and controlled. And
like
people know what they're doing about it now.
Yeah. Well, they actually sedate patients now to do it as well.
And they only really use it for those who are at their last end.
It is one of those
last line things, especially with depression.
Mm-hmm.
If no meds are working, that's when they start to go to.
Yeah. But it's really, from what I've heard and read, it's really more controlled now.
Yeah.
Unlike in the old movies that you see with shoving something in the mouth of the patient to bite down on and then turning up the volts. No, they actually lightly sedate patients to the point where you generally don't remember the procedure.
Yeah, and I've heard that
it's like an ear colonoscopy.
I've heard that it does work, but it can cause short-term memory loss.
Yes, I've heard that too.
Yeah, it does help though.
With that.
Yeah.
Yeah.
Okay, so those kind of therapies, which help to imbue the then therapeutically moribund and demoralized psychiatric profession with a renewed sense of optimism in the curability of insanity and the potency of their craft. There's a lot of interesting words in that sentence for a Wikipedia article.
Yes.
Creative license.
Yeah, a little bit.
The success of the shock therapies, despite the considerable risk they proposed to patients, also helped to accommodate psychiatrists to ever more drastic forms of medical intervention, including lobotomy. The clinical historian Joel Braslow argues that from malarial therapy onward to lobotomy, physical psychiatric therapies spiral closer and closer to the interior of the brain, with this organ increasingly taken centre stage as a source of disease and site of cure. For Roy Porter, one of the doyen of medical history, the often violent and invasive psychiatric interventions developed during the 30s and 40s are indicative of both the well-intentioned desire of psychiatrists to find some medical means of alleviating the suffering of the vast number of patients then in psychiatric hospitals, and also the relative lack of social power of those same patients to resist the increasingly radical and even reckless interventions of asylum doctors. That is a really long sentence.
Literally waiting for you to finish that sentence.
Holy
and be like,
balls.
wow, that is...
Can you copy and paste that sentence? I want to know how many words that was. For Roy Porter.
For Roy Porter.
Down to asylum doctors, that citation.
Yeah.
That is one sentence.
Where do you want me to put this?
Put it in a Word document. I want to know what the word count is. Okay. While you're doing that, many doctors, patients, and family members of the period believe that despite potentially catastrophic consequences, the results of lobotomy were seemingly positive in many instances, or at least they were deemed as such when measured next to the apparent alternative of long-term institutionalism. Lobotomy has always been controversial, but for a period of the medical mainstream, it was even feted and regarded as a legitimate last resort remedy for categories of patients who were otherwise regarded as hopeless. Today, lobotomy has become a disparaged procedure, a byword for medical barbarism, and an exemplary instance of the medical trampling of patients' rights. So it's interesting that back then they even realized that it wasn't a good treatment, but it was better than being in a mental institution for the rest of your life.
Yeah, if you survived it.
Yeah, if you survived it, which is interesting because then that speaks to the quality of the mental institutions back then. Mm-hmm. So how many words was it?
75.
75 words in one sentence. Whoever wrote that needs to...
needs an edit.
It needs an edit.
You can do that now. You can put word count on.
I thought you were going to say you can do that now. I'm about to Wikipedia.
No.
I'm like, you've always been able to do that. That's the point.
Count words.
No, edit stuff.
Oh, no. I mean, like, yeah, there's new functions. I'm just always amazed by Google. Yeah. That you can now turn on your running word count.
There you go. Yes, it is a really long sentence. 75 words. Why?
Get on there and suggest an edit.
All right. So, early psychosurgery. So I think this is pre-lobotomy. Before the 1930s, individual doctors had infrequently experimented with novel surgical operations on the brains of those deemed insane. Most notably, in 1888, the Swiss psychiatrist Gottlieb initiated what is commonly considered the first systematic attempt at modern human psychosurgery. He operated on 6 chronic patients under his care at the Swiss Pfefferger Asylum, removing sections of their cerebral cortex. Burkhardt's decision to operate was informed by 3 pervasive views on the nature of mental illness and its relationship to the brain. First, the belief was that mental illness was organic in nature and reflected an underlying brain pathology. Next, that the nervous system was associated according to an associationist model comprising of an input or afferent system, a sensory center, a connecting system where information processing took place, an association center, and an output or efferent system, a motor sensor. And finally, a modular conception of the brain whereby discrete mental faculties were connected to specific regions of the brain. It's interesting. So those 3 things are actually kind of true, but not probably in the way that they think. So mental illness is pathologized, like it is a pathology. If you look in the brains of people who do have mental illness, there are actual, even physical changes. For those who have chronic anxiety, your amygdala is bigger because it responds quicker and it is trained to respond. So it's bigger than those who don't have anxiety or chronic anxiety.
Yeah, and then you look at the people with like PTSD, complex PTSD.
The amygdalas are bigger in them as
different,
well.
Different again. So it definitely is,
And same with like the chemical, and that's not even talking about the chemical aspect of it.
True.
It's like the brain the reason we give antidepressants is to try and fix the brain chemistry. That's the whole reason. So it's interesting. The second one, how he's talking about the sensory center, the association, and the motor sensor, that's actually a thing. We call them sensory nerves, so the things you see with your eyes or, like all the senses, like you're feeling with your hands, that's the sensory nerves. They communicate in your brain or in your spinal cord with interneurons, they're the connecty bits, and then they send a message back out to do the things with your hands and with your muscles. That's the motor system. So that's actually true.
So that got a bit sciencey and tech then.
It did.
I could... I want just used to do that with your hands because you got little hands.
I don't have little hands.
They're so little.
My hands are fine. Anyway,
I thought mine were little, but...
Anyway, that bit's right. The third part where he says modular conception of the brain, that's where it kind of goes a bit wrong. It's not like this bit controls my left eye. It doesn't work like that. That's what he's saying about modular conception of the brain, is that like each individual part of the brain controls a certain part of you. It doesn't work like that.
Doesn't it?
No, because
I've kind of taught that though.
Yeah, but it's wrong.
Basic level.
It's wrong though. I mean, it is in a very overview kind of way, as in like the frontal part of your brain controls language, but you can't pinpoint to the part of your brain that tells you what, I don't know, how to say the word apple or anything like that. It's a general overview. So if he wanted to treat someone for a language problem, you'd have to remove the whole front of the brain, and that would kill you.
Or just go poking in there while the patient's awake.
Yeah, but they didn't have the technology to do that.
Yeah.
Because if they did that, the patient would die, or they would be in so much pain they wouldn't be able to sit still.
Yeah.
They hadn't worked out the anesthesia ability to go, we'll keep you awake, but this part of your body is completely numb and you can't feel anything.
Yeah,
like,
okay.
They
so they can't go whole Grey's Anatomy?
Nah. It's literally, you're sleeping or not at that point. And sometimes you weren't.
Yeah, gotcha.
Burkheit's hypothesis was that by deliberately creating lesions in regions of the brain identified as an association center, a transformation in behavior might ensue. According to his model, those mentally ill might experience excitations abnormal in quality, quantity, and intensity.
That's in quotes. Look at that.
In the sensory regions of the brain, and this abnormal stimulation would then be transmitted to the motor regions, giving rise to mental pathology. He reasoned, however, that removing material from either the sensory or the motor zones could give rise to grave functional disturbance. Instead, by targeting the association centers and creating a ditch around the motor region, he hoped to break the line of communication and thus alleviate mental symptoms and the experience of mental distress. There's a bit sciencey, but I'm just sort of an analogy to describe it. You imagine you're like in the 1940s and you're calling up someone on the phone.
Hello there.
Hello? And you say, operator,
like just went for both of us.
Operator, connect me to blah, right? That would be the sensory.
Connect me to the queen.
Connect me to blah, right? And then the peg walker goes, okay, and does the board thing, and then the other person goes, oh, hello, and then they connect and they communicate, right?
Is that what your grandmother did?
Yes, it is.
So interesting.
What essentially that person's cutting and thinking is, let's cut out the pegboard person, and then they can't communicate with each other, right?
Yeah.
Because there's nobody to make the connection anymore. So if you remove that intermediate, you can't have that connection. So that's essentially what he's saying, is that if we get rid of the ability for them to communicate signals, they won't have a mental disturbance anymore. But they also might not have much else.
Yeah.
Well, I'm not going to read the rest of this section until we... let me see if I can find... Because it's actually a lot longer than I anticipated.
It always is. Nearly always is.
Let's go down to the first lobotomies.
You want to do development? No.
Oh, no.
Don't worry. You can all go ahead and read,
let's do first lobotomies.
In the article.
On the 12th of November...
I was going to say, holy crap, this is really...
It's really long.
So you're going down to... Right.
Yeah. First lobotomies. On the 12th of November 1935, before the Second World War, at the Hospital Santa Marta in Lisbon, MITS initiated the first of a series of operations on the brains of the mentally ill. The initial patients selected for the operation were provided by the medical director of Lisbon's Miguel Bombarda Mental Hospital, Jose de Matos Sobral Cid. As MITS lacked training in neurosurgery. What?
I lack training, let me do that. Frank's face.
What the fuck?
Frank's what the fuck face is the best.
This is one of those moments where I go, why? Why do people science like this? I'm going to operate on the brains of the mentally ill, but I have no neurosurgery.
Practice.
You don't practice on people by stabbing them with an ice pick.
That's what I'm telling you. They used to do that.
Well, he had all these
poor abandoned psych patients that had, their family left them there, abandoned them, left them to the hospital, and they would go, okay, come with me.
But they didn't do that with just the intention of like, oh yeah, what else are we going to do?
No. They did it with the intention thinking they could probably, maybe, hopefully help them.
But there also was a scientific reason behind their thinking.
Of course.
They were thinking about it. Their science was flawed, but they were thinking about it. It wasn't like, oh, what if I do this? Like they had a theory before they did it.
They did, but also it kind of didn't really matter if it didn't work out.
Yeah, but they kept doing it, did they?
Yeah.
So he had no training in neurosurgery. Maybe he was like a psychiatrist or something, but he had no training in neurosurgery. So it was just like, what? And his hands were crippled from gout.
Even better. That makes for a really good surgeon.
The procedure was performed under general anesthetic by Pedro Alameda Lima, who had previously assisted Benitez on his research on cerebral angiography. The intention was to remove some of the long fibers that connected the frontal lobe to other major brain centers. To this end, it was decided that Lima would trephine the side of the skull and then inject ethanol into the subcortical white matter of the prefrontal area. I want to know what trephine means.
I can help you. Where's the word?
Up. There.
The surgical instrument with a cylindrical blade. Ah, cool.
Typically designed for obtaining a cylindrical shaped core of bone. Right.
I'm going to chuck that in the chat box if people want to...
Alright, would trephine into the side of the skull and then inject ethanol into the prefrontal area so as to destroy the connecting fibers or association tracts and create what Benitez termed a frontal barrier. Maybe that's what you were talking about in terms of
Yeah, because he was like, ew, and then the thing was like...
Yeah, and he was trying to inject something into the brain and then it didn't work.
No, I'm sure it was like drilling into the brain.
Right. Anyway.
Oh, maybe to inject... I have to watch it again.
Yeah.
That was a blur. Totally good show.
After the first operation was complete, Benitez considered it a success and observing that the patient's depression had been relieved and declared her cured, although she was never in fact discharged from the mental hospital.
That sounds so much like Ratchet. I'm wondering if they based the surgeon in Ratchet on...
Well, yeah, quite possibly.
Yeah, it's very clever. Because it sounds like what he said. He's like, she's cured. And then it's like, but she's not doing anything.
Was he Swiss, Portuguese?
He was Filipino, I think.
Right.
Yeah.
Okay, interesting.
American Filipino, yeah.
Benitez and Lima persisted with this method of injecting alcohol into the frontal lobes for the next 7 patients, but after having to inject some patients on numerous occasions to elicit what they considered a favourable result, they modified the means by which they would section the frontal lobes. For the 9th patient, they introduced a surgical instrument called a leucotome. This is a cannula.
Oh, looking up that one.
That is 11 centimetres in length and 2 centimetres in diameter.
Oh, I've seen them in the museum, actually.
2 centimetres in diameter.
Yeah.
That's a lot.
It's like bigger than a straw. It's like a bubble tea straw.
Yeah. It's not 2 millimetres. 2 centimetres in diameter.
Yeah. It's like the bubble tea straw.
Yeah. It had...
Maybe bigger.
It had a retractable wire loop at one end that, when rotated, produced a 1 centimetre diameter circular lesion in the white matter of the frontal lobe. Typically, 6 lesions were cut into each lobe, but if they were dissatisfied, Lima might perform several procedures, each producing multiple lesions and in the left and right frontal lobes. By the conclusion of this first run of leucotomies in February 1936, Benitez and Lima had operated on 20 patients, with an average period of 1 week between each procedure. Benitez published his findings with great haste in March of the same year. The patients were aged between 27 and 62, 12 were female and 8 were male. 9 of the patients were diagnosed with depression, 6 from schizophrenia, 2 from panic disorder, 1 each from mania, catatonia, and manic depression. Wow. Manic depression is the old name for bipolar, by the way.
But what about mania?
Mania is psychosis.
Is it?
Yeah. And catatonia is like catatonic state.
Yeah.
With the most prominent symptoms being anxiety and agitation. The duration of the illness before the procedure varied from as little as 4 weeks to as much as 22 years,
Jesus.
although all but 4 had been ill for at least a year. Patients were normally operated on the day they arrived at Manit's clinic and returned within 10 days to the Miguel Bombarda Mental Hospital. The perfunctory post-operative follow-up assessment took place anywhere from 1 to 10 weeks following surgery. That wouldn't fly in terms of today's scientific rigor.
No.
You don't have such a wide difference between your follow-up appointment. 10 weeks is a long time.
It is. Different to 1 week. That's
Yeah.
for sure.
Complications were observed in each leucotomy patient and were included increased temperature, vomiting, bladder and bowel incontinence, diarrhea, and ocular affections such as ptosis and nystagmus, as well as psychological effects such as apathy, akinesia, lethargy, timing and local disorientation, kleptomania,
That's amazing.
and abnormal sensations of hunger.
Kleptomania. That's amazing.
Totally-
I just looked at ptosis. I didn't realise what ptosis was. It's drooping or falling of the upper eyelid.
Yeah, because your brain's
nystagmus.
fucked.
Nystagmus is involuntary eye movement. Oh, mine went away. Dancing eyes, yeah.
Yeah, because your brain's fucked. You fucked up the connections between your brain and your eyes.
No, mine comes on from stress and no sleep.
Yeah. Manitz asserted that these effects were transitory, and according to his published assessment, the outcome of these first 20 patients was that 35%, or 7 cases, improved significantly, another 35 were somewhat improved, and the remaining 30 were unchanged. There are no deaths, and he did not consider that any patients had deteriorated following leucotomy. Okay.
Inception. We're on Maia's TV. And thank you, Maia. Myers. I just saw that we got a Patreon pledge from Maia Myers. Thank you so
Maia.
much.
All right. There actually was a little
TV.
quote here too. The hypothesis underlying the procedure might be called into question. The surgical intervention might be considered very audacious, but such arguments occupy a secondary position because it can be affirmed now that these operations are not prejudicial to either physical or psychic life of the patient, and also that the recovery or improvement may be obtained frequently this way, says Igor Munitz in 1937.
Ah. Don't be alarmed, but I forgot to record.
Are you fucking kidding me?
I'm sure there'll be a way to get the recording from Twitch. I'm not used to streaming and recording. Like, I'm used to just hitting the stream button and not hitting the...
You're lucky I love you. Let me continue.
You continue. I'm just gonna Google how to say.
Okay, so this is the next section is reception. Manitz rapidly disseminated his results through articles in the medical press and a monograph in 1936. However, the medical community was initially hostile to the new procedure. On the 26th of July 1936, one of his assistants, Diogo Furtado, gave a presentation at the Parisian meeting of the Société Médico-Psychologique on the results of the second cohort of patients leucotomized by Lima. Sobrosid, who had supplied Munitz with the first set of patients for leucotomy from his own hospital in Lisbon, attended the meeting and denounced the technique, declaring that the patients who had returned to his care post-operatively were diminished and had suffered a degradation of personality. You go, Sid. He also claimed that the changes Manitz observed in patients were more properly attributed to shock and brain trauma, and he derided the theoretical architecture that Manitz had constructed to support the procedure was cerebral mythology. At the same meeting, the Parisian psychiatrist Paul Corbon stated he could not endorse a surgical technique that was solely supported by theoretical considerations rather than clinical observations. He also opined that the mutilation of an organ could not improve its function, and that cerebral wounds were occasioned by leucotomy risked the later development of meningitis, epilepsy, and brain abscess. Nonetheless, Manitz reported successful surgical treatment of 14 out of 20 patients led to the rapid adoption of the procedure on an experimental basis by several individual clinicians in countries such as Brazil, Cuba, Italy, Romania, and the United States during the 1930s. So there's bits about Italian leucotomy, American leucotomy, transorbital leucotomy, so that's drilling holes into the scalp,
Yes.
so down. There's lots and lots of things. Let's
Yes.
look at the American one. Because I'm sure the Italian one's very interesting, but I'm interested in the American one.
Okay.
The first prefrontal lobotomy in the US was performed at the George Washington University Hospital on the 14th of September 1936 by neurologist Walter Freeman and his friend and colleagues, the neurosurgeon James W. Watts. Freeman had first encountered Monitz at the London-hosted Second International Congress of Neurology in 1935, where he had presented a poster exhibit on the Portuguese neurologist's work on cerebral angiography. Fortuitously occupying a booth next to Monitz, Freeman, delighted by their chance meeting, formed a highly favourable impression of Monitz, later remarking on his sheer genius. According to Freeman, if they had not met in person, it is highly unlikely that he would have ventured into the domain of frontal lobe psychosurgery. Freeman's interest in psychiatry was the natural outgrowth of his appointment in 1924 as the medical director of the research laboratories of the Government Hospital for the Insane in Washington, known colloquially as St. Elizabeth's. Ambitious and prestigious researcher Freeman, who favoured an organic model of mental illness causation, spent the next several years exhaustively, yet ultimately fruitlessly, investigating a neuropathological basis. Chancing upon a preliminary communication by Monitz on leucotomy in the spring of 1936, Freeman initiated the correspondence in May of that year, writing that he had been considering psychiatric brain surgery previously. He informed Monitz that, having your authority, I expect to go ahead. Monitz, in return, promised to send him a copy of his forthcoming monograph on leucotomy and urged him to purchase a leucotome from a French supplier.
Okay.
Specifically by a French one.
Yeah.
Upon receipt of Monitz's monograph, Freeman reviewed it anonymously for the Archives of Neurology and Psychiatry. He did it anonymously, interestingly enough. Praising the text as one whose importance can be scarcely overestimated. He summarized Monitz's rationale for the procedure as based on the fact that while no physical abnormality of cerebral cell bodies was observable in the mentally ill, their cellular interconnections may harbor a fixation of certain patterns of relationship among various groups of cells. Interesting. So they adapted their method for known as the Monitz method to the Freeman-Watts technique, which is also known as the Freeman-Watts standard prefrontal lobotomy.
Okay.
All right. So let's go to the prevalence. It's only a short paragraph, so not too long. In the United States, approximately 40,000 people were lobotomized.
How many?
40,000.
Wow.
In England, 17,000 lobotomies were performed, and the three Nordic countries of Denmark, Norway,
I think Frank just
Sweden.
Invented a place.
Denway.
Welcome to Denway.
Don't tell the Danish and the Norwegians that I combined their countries.
Yeah.
I don't think they'd like that very much.
Welcome to Denway.
Norway and Sweden had a combined figure of approximately 9,300. Scandinavian hospitals lobotomized 2.5 times as many people per capita as hospitals in the US. Sweden lobotomized at least 4,500 people between 1944 and 1966, mainly women. This figure includes young children. In Norway, there were 2,005 known lobotomies. In Denmark, there were 4,500. And in Japan, the majority of lobotomies were performed on children with behavioral problems.
Oh, wow.
In Germany, in the Soviet Union, it banned the practice in 1950 on moral grounds. The Soviet Union had a right idea at the time.
Yeah.
In Germany, it was only performed a few times. Interestingly enough, that's interesting. I'm surprised they didn't perform it more, considering the Nazis.
Well, you're just making assumptions.
No, hang on. The Nazis did awful things to people in concentration camps.
Yeah.
Why not do lobotomies? Why stop there?
I believe you're promoting this.
No, I'm not. But I'm not promoting it. I'm just saying it's interesting that's where they drew the line.
Yeah.
we
draw the line there.
We draw the line there. We can gas hundreds of thousands of people, but we won't do lobotomies.
I have good news for you.
Why?
My Twitch is saved to automatically save our broadcast for up to 14 days, and I should be able to download it from there.
Amazing. I'm glad that there was a safeguard there.
Could be dead.
You could have died. By the late 1970s, the practice of lobotomy had ceased generally, though it continued as late as the 80s in France.
Wow. Doesn't really surprise me though.
The French are weird.
Yeah.
Oh, right. So criticism. As early as 1944, an author in the Journal of Nervous and Mental Diseases... Yeah, the author.
Oh, the author.
The author.
Not in author.
Yeah. The author of the Journal of Nervous and Mental Diseases remarked the history of the prefrontal lobotomy has been brief and stormy. Its course has been dotted with both violent opposition and with slavish, unquestioning acceptance. Beginning in 1947, Swedish psychiatrist Snore Wolfhart evaluated early trials reported... Snore Wolfhart.
Where are you reading? Which paragraph are you up to?
Looking up criticism?
Yeah, we are.
Yeah, about there.
Oh, there.
Snore Wolfhart.
I'm going to put that name in the chat. That's impressive. It's a good name for a dog, I imagine.
Snore Wolfhart.
Yeah.
Evaluated early trials reporting that it is distinctly hazardous to lobotomize schizophrenics, and that lobotomy was still too imperfect to enable us, with its aid, to venture on a general offensive against chronic cases of mental disorder, stating further that psychosurgery has yet failed to discover its precise indications and contraindications, and the methods must unfortunately still be regarded as rather crude and hazardous in many respects. The USSR officially banned the procedure in 1950. On the initiative of Gilerovsky, doctors in the Soviet Union concluded that the procedure was contrary to the principles of humanity, and through lobotomy, an insane person is changed into an idiot. Well, back then, the term idiot was a medical term.
Yeah, I know.
Yeah.
So read that sentence again.
Soviet Union concluded that the procedure was contrary to the principles of humanity, and through lobotomy, an insane person is changed into an idiot.
An insane person is changed into an idiot.
Yes. In the 1977 US Congress, during the presidency of Jimmy Carter, created the National Committee for the Protection of Human Subjects of Biomedical and Behavioral Research to investigate allegations that psychosurgery, including lobotomy, was used to control minorities and restrain individual rights. The committee concluded that some extremely limited and properly performed psychosurgery could have positive effects. Yeah, extremely limited and properly performed. There have been calls in the early 21st century for the Nobel Foundation to rescind the prize it awarded to Minitz for developing lobotomy, a decision that has been called an astounding error of judgment at the time, and one that psychiatry might still need to learn from. But the foundation declined to take action and has continued to host an article defending the results of the procedure. What the hell?
That's a lot of words.
So people are saying to the Nobel Prize Foundation, take away the Nobel Prize.
Yeah.
And the Nobel Prize people are just like, yeah, no.
Oh.
They defended it, essentially, saying that there is reasons why it was given. I mean, obviously there were reasons, but it's against all human rights, isn't it? But anyway.
And we look at notable cases. That's my favourite part, I think.
Yeah, that's always your favourite part.
Pop culture
and that's the boring bit.
Really? They didn't even have pop culture references.
I think I might have to go back to transorbital lobotomy. I'm going to go back to that. But before I do, we'll go and do this bit first.
We should.
Why?
I think we've been going for a while.
Transorbital lobotomy is the one where they go through the eye socket. I didn't describe that one.
Yeah. Okay, you can go back.
Okay, we'll go back. Just quickly. Transorbital lobotomy.
All right. Because Frank doesn't want to miss out on transorbital lobotomies. As long as you promise we can cover
of course,
very small dot list of notable cases.
Well, there actually is a larger list, but
if you go
lobotomized people. So the Freeman-Watts prefrontal lobotomy still required drilling holes into the scalp, so surgery had to be performed in an operating room by trained neurosurgeons.
Yes.
Walter Freeman...
Or not trained, needing training.
Oh, who had gout in their hands. Gout hands. Walter Freeman believed the surgery would be unavailable to those he saw as needing it most. Patients in state mental hospitals, but they had no operating rooms, surgeons or anaesthesia, and limited budgets. Freeman wanted to simplify the procedure so it could be carried out by psychiatrists in psychiatric hospitals, not surgeons, psychiatrists. Inspired by the work of Italian psychiatrist Amaro Fiamberti, Freeman at some point conceived of approaching the frontal lobes through the eye sockets instead of through drilled holes in the skull. In 1945,
I told you they used to drill holes in the skull.
In 1945, he took an ice pick from his own kitchen and began testing the idea on grapefruit.
Poor grapefruit.
And cadavers. This new transorbital lobotomy involved lifting the upper eyelid and placing the point of a thin surgical instrument, often called an orbioclast or a leucotome, although quite different from the wire loop leucotome described above, under the eyelid against the top of the eye socket. A mallet was used to drive the orbioclast through the thin layer of bone and into the brain, along the plane of the bridge of the nose, around 15 degrees towards the interhemispherial fissure. So like an angle like that much.
I just, when you said like the mallet, I put up the little bop mallet thing, the smiley face.
A mallet was used to drive, the orbital class was malleted 5 centimeters into the frontal lobe, then pivoted at 40 degrees at the orbital perforation so that the tip cut towards the opposite side of the head, towards the nose, so it goes that way.
Yeah.
The instrument was returned to the neutral position and sent a further 2 centimeters into the brain before being pivoted around 28 degrees to each side.
I feel like I could feel this.
I know, me too. No. To cut outwards and again inwards. In a more radical variation, at the end of the last cut described, the butt of the orbitoclast was forced upwards, so the tool cut vertically down the side of the cortex of the interhemispheric fissure, called the deep frontal cut.
Nice.
All cuts were designed to transect the white fibrous matter connecting the cortical tissue of the prefrontal cortex to the thalamus. The leucotome was then withdrawn and the procedure repeated on the other side. Well, let's just do it once, let's do it twice. Freeman performed the first transorbital lobotomy on a live patient in 1946. Its simplicity suggested the possibility of carrying it out in mental hospitals lacking the surgical facilities required for the earlier, more complex procedure. Freeman suggested that where conventional anesthesia was unavailable, electroconvulsive therapy could be used to render the patient unconscious. Okay, sure.
Wait, so like ECT them to unconsciousness and then
give them a transorbital lobotomy.
Right, makes sense.
Okay.
Nope.
No. In 1947, the Freeman and Watts partnership ended, as the latter was disgusted by Freeman's modification of the lobotomy from a surgical operation to a simple office procedure. So one of them was like, dude, this is not cool.
Too much.
You've gone too far with this, mate. In between 1940 and 1944, 684 lobotomies were performed in the United States. However, because of the fervent promotion of the technique by Freeman and Watts, those numbers increased sharply toward the end of the decade. In 1949, the peak year for lobotomies in the US, 5,074. 1949.
Wow.
Yeah, 4 years after the Second World War ended.
Okay.
Cut off. In 1949, the peak year of lobotomies in the US, 5,074 procedures were undertaken, and by 1951, over 18,000 individuals had been lobotomized in the US. So it had gone from 684 to over 5,000 to nearly 20,000 in the space of 4 years?
What? That's absolutely
maybe 6 years?
Wow,
yeah, in 6
ridiculous.
years it had gone from 600 cases to 20,000.
Yeah, I'm with Maia land on here. Nope.
Okay.
Like my eye seriously stings right here. I guess where I would have like.
No, it's under there.
Under where?
Under there.
Under here, but don't they go from the corner of your eye?
No, under there.
Is it?
Yeah.
Anyway, it still bloody hurts.
No.
No. My eye hurts for no reason.
All right, so you're on to your favourite bit.
Oh, yes. There isn't that many. I had a quick look ahead.
Ah, okay.
Go on.
Notable cases. Rosemary Kennedy.
Yes.
The sister of JFK. Underwent a lobotomy in 1941 that left her incapacitated and institutionalized for most of her life.
Yeah, that's pretty sad.
Howard Dully wrote a memoir of his late life discovery that he'd been lobotomized in 1960 at the age of 12.
What?
How does one not know?
Oh, wow.
Like, what? How do you not know that you've been lobotomized until later?
So the late life discovery, they've been, wow. That'd be an interesting memoir. I might track that down.
New Zealand author and poet Jeanette Frame received a literary award in 1951, the day before a scheduled lobotomy was to take place, and it was never performed. Interesting. Josef Hasid, a Polish violinist and composer, was diagnosed with schizophrenia and died at the age of 26 following a lobotomy. 26? That's me. That's how old I am. Swedish modernist painter Sigrid Jeftin died following a lobotomy in 1948. American playwright Tennessee Williams' older sister Rose received a lobotomy that left her incapacitated for life. The episode is said to have inspired characters and motifs in certain works of his. It is often said that when an iron rod was accidentally driven through the head of Phineas Gage,
Who did that one?
was one of my very first ones,
Yeah.
in 1848, this constituted an accidental lobotomy, or that this event somehow inspired the development of surgical lobotomy a century later. According to the only book-length study of Cage, careful inquiries turn up no such link. So, no such historical link.
Yeah, but how could it not kind of inspire people? Like,
Well, the thing is, it did the opposite.
doctors or something.
It did the complete opposite. He was a lovely, lovely guy, and then they had the road go through his brain, and he turned into a fucking arsehole.
Yeah, but I wonder if that could have inspired doctors to go, oh, it changed his personality. I wonder if we can do it to try benefit.
But at the same time, their goal was never to change people's personality. It was to rid them of mental disorders.
No, but it was, because they had, like, people with, not manageable personality behaviour, but it's really their personality.
Well, it's not. Your behaviour and your personality are two different things.
Yeah, okay.
Like, my personality involves things like I don't know, maybe they are different things. They're linked, but they are different things.
Stella!
Anyway, yeah, but I reckon that he was lobotomized in some way. Like, definitely was a related thing, as in
Phineas
like,
Gage,
as in like a separation of the tissues in his brain, obviously.
But
yeah.
Episode that one.
So in 2011,
That's not long ago.
nope, that was only 9 years ago.
That was 9 years ago. It feels like 2 years
I know,
ago.
right? Daniel Nielsen, an Argentine-born neurosurgeon at Yale, examined x-rays of Eva Peron and concluded that she underwent a lobotomy for the treatment of pain and anxiety in the last months of her life. Who is Eva Peron?
Wasn't she like the ruler of somewhere?
Oh, she was the wife of Argentine President Juan Peron and the First Lady of Argentina from 1946 to her death in 1952.
We know First Ladies are really like the leaders.
Yeah.
So I thought it was the leader.
Well, that's how you get the whole behind every successful man is a loving wife or anything.
More successful women, isn't it?
No, I thought it was something like a good wife or something like. Look it up.
I don't know. Phineas Gage and the Iron Rod. We did episode 21.
Oh, I thought it was a lot.
It was earlier than that too. Yeah, no, it was when we were like churning them out pretty quickly.
Yeah.
Oh my god, do you remember Bird Wars?
Bird Wars is great.
And do you remember Jiv?
That was stupid.
The mongoose, and I still can't remember what a mongoose actually is.
It's like
a goose.
No, it's a moose. It's not a moose. It's not a goose. It's like a rodent-y kind of thing. Like a rodent-y kind of thing. Not really. It's not even a rodent. It's like an ermine or a weasel. And they're quite big.
Because I've fully pictured Jeff, the talking mongoose, to be a moose, like Rocky and Bullwinkle. Like,
no, I can't believe you don't know what a you didn't know. Hang on.
No, I knew you were going to bring that up. No.
Scout didn't realise that flamingos were real until not that long ago.
I've never seen one until I saw a video.
They thought they were a fictional animal. And then they found out that they were real.
In real life.
I'm going to take you somewhere to find a real one.
I think I would shit myself. I mean, it's no different to the usual, but yeah.
Holy shit, they're actually real?
Yeah, a mythical creature coming towards me.
No, they're not mythical. They're real. I can't believe you didn't know flamingos were real.
If only I could think of the funny thing that you didn't know was real.
I know everything's real. Everything that is real. I don't know. Okay,
not the
last bit. Literary and cinematic portrayals. I could skip this,
What's that? No,
I
please
could skip
don't.
this,
It's my favourite
because you're being a
part.
butthead.
You're being a butthead.
Lobotomies have been featured in several literary and cinematic presentations that both reflected society's attitude towards the procedure and, at times, changed it. Writers and filmmakers have played a pivotal role in turning public sentiment against the procedure. Robert Penn Warren's 1946 novel All the King's Men described a lobotomy as making a Comanche brave look like a tyro with a scalping knife, and portrays the surgeon as a repressed man who cannot change others with love, so he instead resorts to high-grade carpentry work.
I think that's in quotes.
High-grade carpentry work.
Yeah.
Tennessee.
There you go, Maia. Tennessee Williams.
Tennessee Williams criticised lobotomy in his play Suddenly last summer in 1958 because it was sometimes inflicted on homosexuals to render them morally sane. In the play, a wealthy matriarch offers the local mental hospital a substantial donation if the hospital will give her niece a lobotomy. which she hopes will stop the niece's shocking revelations about the matriarch's son.
What?
Warned that the lobotomy might not stop her niece's babbling, she responds that maybe, maybe not, but after the operation, who would believe her, doctor?
Wow.
Blech.
Wow.
In Ken Kesey's 1962 novel One Flew Over the Cuckoo's Nest and its 1975 film adaptation, lobotomy is described as frontal lobe castration, a form of punishment and control after which there is nothing in the face, just like one of those store dummies. In one patient, you can see by his eyes how they burned him out over there. His eyes are all smoked up and grey and deserted inside.
I believe those were lines of dialogue.
Jesus.
Yeah.
Yeah.
You haven't watched that, have you?
No, I haven't.
Oh, I need to watch it. Jack Nicholson's just young and fantastic in that movie.
Yeah.
Yeah. And that's where Nurse Ratched was the nurse, the head nurse in One Flew Over the Cuckoo's Nest.
Oh, okay. Yeah.
Yeah, that fictional character's like, before One Flew Over the Cuckoo's Nest was then like the inspiration for Ratched. Yeah.
In Sylvia Plath's 1963 novel The Bell Jar, the protagonist reacts with horror to the perpetual marble calm of a lobotomized young woman. Elliot Baker's 1964 novel and 1966 film version, A Fine Madness, portrays the dehumanizing lobotomy of a womanizing, quarrelsome poet who afterwards is just as aggressive as ever. The surgeon is depicted as an inhumane crackpot.
You inhumane crackpot.
In the 1982 biopic, Frances depicts actress Frances Farmer, the subject of the film, undergoing transorbital lobotomy, though the idea that a lobotomy was performed on Farmer and Freeman performed it has been criticised as having little or no factual foundation.
You mentioned Freeman earlier. Wow.
And there's some other things listed in there. Bioethics and medical ethics, psychosurgery, frontal lobe injury, history of psychosurgery in the UK. But
you Phoenix Gage is in frontal lobe injury.
Oh, yeah, for sure.
So fascinating.
Fascinating. And there was even like a bit that I skipped.
Showing. Yes, there was a big chunk that you showed. This needs to be updated though. We've got cinematic portrayals. Well, it hasn't got Ratched in there, and I'm sure there's been more.
Off you go.
Since then. No thanks.
I was going to say, we're not going to that kind of wiki hole.
No. Start adding information. I just blended adding and editing together. Editing stuff to, yeah. Yes. Rosemary Kennedy's a sad case. JFK's eldest sister.
She lived for quite a long time, though. She died at 86.
Yeah. She did, but what kind of life was that? She was basically kept secret from...
How old was she when she had the lobotomy?
Oh, this is like a whole other episode, really.
Maybe a follow-up.
Maybe one for me. To name Rosemary Kennedy. She's not really dark. I don't want to deem her as dark and that's creepy though.
But she's not dark and creepy. The whole point of this is to look at the bits in our history that people don't look at.
Yeah, well, the problem was apparently in her early young adult years, Kennedy experienced seizures and violent mood swings. In response to these issues, Kennedy's father arranged for a prefrontal lobotomy for Kennedy in 1941 when she was 23 years of age.
23.
So shitty.
Sorry.
The procedure left Kennedy permanently incapacitated and rendering her unable to speak intelligibly. She spent the most of the rest of her life being cared for at St. Coletta, an institution in Jefferson, Wisconsin. The truth about her situation and whereabouts was kept secret for decades, yeah. I believe sometimes they even just said that she died when she was young and stuff. She's initially isolated from her relatives following her lobotomy. Kennedy visited with her family during her later life. But yeah, I believe there was a whole chunk where they just pretended she didn't exist because she didn't fit that Kennedy image.
And they obviously felt enormous shame for what they did to her.
Hopefully.
I mean, I would.
So they should. She has seizures and violent mood swings. Well, let's give her a lobotomy.
You've also got to remember the Kennedys are kind of what you would call almost American royalty.
Oh, yeah.
So in other words, their family was in the higher circles of American society for
that's what I mean. Like,
generations.
They couldn't have like a damaged Kennedy.
Exactly right.
Walking around. No. It was very, very interesting.
It was very sciencey.
Very sciencey. Not creepy. Dark.
It is creepy.
Dark part of history.
It is kind of creepy. I would call it, I don't know. It didn't really go into too much about like the societal aspects of it too much. I think that's where that's the thing about sometimes these Wikipedia articles is you're looking for certain information, like where we're kind of looking for the societal impacts or like what people actually came out like, or the way that they were treated in hospitals, or what proportions of people were there. So in other words, were people of color were more targeted than people who not people of color. Obviously, they said that women were targeted a lot more. Yeah. Why were the kids done? Like that kind of thing. What did the kids have?
Yeah.
Especially in Japan. Like, what? Why? Yeah, so those are the kind of things that we were looking for. But Wikipedia is edited by people. It can be edited by anyone.
It can. I mean, it has to pass. Like...
It doesn't... It does have to... Yeah, there's rigorous, what's it called, screening and stuff.
Yeah, you can't just change stuff on the fly.
Yeah. The article didn't really go into any of that, and that's sometimes where Wikipedia fails a little bit, is it doesn't always bring up the information you're looking for, which is why you should never use Wikipedia as a reference in an essay.
Correct.
Ever.
It is not a credible source.
It's a tertiary source.
Yes.
Because it's collecting.
But the fun thing, as I tell people, you can go then to the references and citations used in Wikipedia to find the
original statement.
Source.
Yeah.
Yes. Don't just, it's fine to use Wikipedia, but go back to that original source.
Do you know what's another reference I didn't mention in that, though? What was it called? Sucker Punch?
The movie?
Yeah, the really arty movie. Yes. She gets a lobotomy at the end of the film.
I don't think I watched the ending.
Spoilers!
You ruined it for me.
Spoilers.
A long time to watch it.
Yeah, it's been out for like 10 years.
Yeah, I know. Okay. It's another film I need to
Yes, you do. It's good. I don't feel like enough people watched it. I feel like, if they did, they didn't get it.
I usually show the clip of the opening sequence as a highlight for
what's the opening sequence
is done really well. It shows like their backstory, the girl's backstory.
where she's trying to defend her brother or something from her sister from an abusive dad, and she gets taken away. Yeah, that's right. Yeah, I remember that now.
It's really well done.
Yeah, it's a really well done movie, but not enough people have seen it.
Yeah, it's such a good way of doing an opening scene, and cleverly delivering that backstory without so much hand holding and being like, these are these girls and this is what happened to them, blah blah blah.
And it's really clever. It's like
reveals a lot in like 2 minutes.
Yeah.
If that.
And it like passes the Bechdel test by a fucking mile.
Oh, is it?
Yeah.
Okay.
Yeah. Passes it by a fucking mile, and it's all about super powerful and empowered women, and it's awesome. It's such a good film.
We should watch it soon when I'm done with Halloween films.
Yeah, I feel like
31 and 31. I'm up to 22. I don't think I'm not gonna finish. Or is 31?
Sucker Punch is a show reel.
Yeah, is that a bad thing? It is very.
I like it.
It's pretty.
It's actually it's beautifully made.
Yeah.
So. And the soundtrack was awesome. But we should leave it there.
Yeah.
Yeah.
Cool. Cool. Good article.
Yeah.
Wonder if we should do a live one again.
Well, do people like it? Do we like the live ones? Do we want more?
It's a cool option. Thank you for tuning in. Awesome. I guess if there's, more demand, we'll do some more live ones.
Yeah.
If not, I mean, I'll edit this one and get this published and...
Oh, you don't need to do too much editing, I don't think.
No.
It's one way to stop us from rambling on and on and on and on and on and on.
Yeah, and the cats have been so good. So sorry if people tuned in to
see the cats,
catch a glimpse of cats, but
they're all sleepy.
They're sleepy. Perfect time. We should note this time. 8 o'clock was a good time to get started on a podcast.
They'll wake up in an hour or two.
They will, and they'll demand their dinner. So
yes.
Cool.
That's the face I make when you say that the moon landing is fake.
The moon landing's fake. It's a different face.
Is that a Bob Ross emoji?
Yes. Cool story, Bob.
Okay. See you next time. Oh dear.